Hi, my name's Dr. Richard Newton. I'm a GP here in Perth, Remede Wellness Medicine. It's a practice that's a little bit different to the normal because we combine Western medicine with natural and integrated disciplines. I like to talk about common health issues that crop up during my week, which I think might be of interest to lots of people. So what we're going to talk about now is how do I make sure I don't have cancer? So sometimes people come to see me and they say, hey, doc, I want to get all the tests done to make sure I don't have cancer. And unfortunately, that blood test doesn't exist. There's not been a single blood test that rules them all, as it were, that can look for the presence of any cancer in the body. But of course, we do have a number of tests that we can do for the right people at the right time that can be very useful for us in terms of cancer detection. So the first one we'll talk about is PSA, which you've probably heard of, prostate specific antigen. It's a blood test that can help pick up any prostate cancer in men. When should it be done? Well, the recommendation has changed a little bit. It used to be starting from the age of 55. That's now changed to 50, possibly even 40 in certain situations, like for guys who have a very strong family history of prostate cancer. The next one we'll talk about is bowel cancer screening. So that starts from the age of 50, and of course it's a stool sample that gets sent off to look for the presence of blood, and it's incredibly useful to pick up both bowel cancer and polyps that might need further investigation. Then of course there's the mammogram breast screening program in women, and that starts from the age of 50. And also in women, of course, the cervical screening program, which has dramatically reduced the risk of cervical cancer in women. And then that's not to forget, of course, skin cancer checks. So skin cancer, of course, is the most common form of cancer in Australia, and it's easy for us to do a skin check once every year or two and make sure there's no early warning signs of skin cancer there. Another test that's become available more recently is CT scanning of the chest to pick up lung cancer in smokers or ex-smokers that we can now refer for. And this brings to mind a patient that came in to see me quite recently. He was a guy similar age to me. I'm 57, fit and well man, but the problem that he'd had was that he'd had a chest infection over the last few months, which had just not got better. He'd had a couple of 2 or 3 courses of antibiotics, but never really quite cleared the problem up. And for me, this immediately started to raise some red flags and send off some alarm bells. So we sent him off for a CT scan of his chest, and sure enough, it did actually show that he had a lesion there. So we were able to get him seen by a respiratory specialist very quickly, within a few days. And he's had some further tests done, and unfortunately he does have a lung cancer, but because we've been able to pick it up really early, we're hoping that we'll be able to offer him a complete cure. So I think the point there is that the tests are of course really important, but probably even more important than that is having a good relationship with your doctor and to not sit on any potential warning symptoms or signs. In other words, the tests are great, but it's really listening and experience that really saves lives. So I hope you found this short talk interesting. If so, please do give me a like or subscribe. If you have any questions, then please drop them in the comments below. I will be releasing more videos about health, wellness, and preventative topics. And if you're in Perth and you're looking for a more holistic approach to your health, then please do reach out to us here at Remede Wellness Medicine. Thanks for watching.